السلام عليكم ورحمة الله وبركاته. Anatomy of the cranial nerve number 5, trigeminal nerve. Uh, Regarding to trigeminal nerve, trigeminal, this nerve not included in number 1973. So this nerve mainly sensory and small part motor. So this nerve mainly sensory. It is the main sensory of the skin of the face. Pain, temperature, proprioception, discriminative touch, and so on. And also motor regarding to the muscle of mastication mainly اللي هي الماسيتر التمبوراليز الميديال and lateral pterygoid. Trigeminal means tri يعني give 3 branches. This nerve supply mostly the skin of the face and the eye. So regarding to the distribution of this nerve, will supply the skin of the forehead and the eyeball and the skin of the upper eyelid by what is called ophthalmic division. And the ophthalmic division of the trigeminal mainly sensory. And also supply the skin of the lower eyelid, skin of the anterior part of the temporal, and the skin of the zygomatic, skin of the side of the nose, and the skin of the upper lip, and this by nerve named maxillary. So the maxillary also mainly sensory. The remaining part of the face, supplied by mandibular, supply the skin of the buccal, cheek, skin of the lower lip and chin, skin of the lower teeth, and supply of the skin of the parotid region and the temporal and the auricle. So this by mandibular. This is regarding to the mandibular sensory and the small part of the mandibular. It is the only part of the trigeminal which contains the motor division. Supply any muscles, muscle of mastication, masseter temporalis, medial and lateral pterygoid. Two muscles named tensor. Any muscles in this block named tensor supplied by mandibular, tensor tympani and tensor palatii. And also supply mylohyoid muscle, oral diaphragm, and anterior belly of digastric. This is regarding to the trigeminal nerve in general. We will shift to more details about the trigeminal nerve. Trigeminal nerve arises from the brainstem by four nuclei. One in the midbrain, one in the pons, and one in the medulla. All are sensory. In the midbrain, so this nucleus named mesencephalic nucleus. In the pons, sensory also. It is named main sensory nucleus. And in the medulla, named spinal trigeminal nucleus. Three sensory nuclei and one motor in the pons named motor nucleus of trigeminal. So totally we have four nuclei to trigeminal nerve. All these nuclei will give input to trigeminal ganglia. So this is a trigeminal ganglia in the middle fossa, which is near or lateral to the cavernous sinus, trigeminal ganglia, or it is named Gasserian ganglia. This ganglia will divide into three divisions. One division to supply the eyeball and the nose and the skin of the forehead and the upper eyelid skin, sensory only, so it is named ophthalmic. And the other nerve to the side of the cheek, zygomatic and upper lip and the lower eyelid, it is named maxillary. And finally, we have another one, supply the mandible, mastication, and the skin of the lower lip, lower teeth, and cheek, and the skin of the parotid region, and the orcal, and the posterior part of the temple. It is named mandibular. طيب, each nerve have its exit from the skull. Ophthalmic exit from the superior orbital fissure. Very important in many questions. Which nerve emerge or passing through superior orbital fissure? Ophthalmic. Ophthalmic, after that, will go to the orbit and give three branches into the orbit. Frontal branch to supply the forehead, and lacrimal branch to supply the lacrimal gland, which is related to the eyeball, and nasociliary, which supply the nose, and the ciliary, the eyeball, cornea, upper eyelid, and so on. This is regarding ophthalmic. Ophthalmic mainly sensory. What means by sensory? Here in the midbrain, the nucleus mesencephalic, the main function is proprioception. But here in the bones, the sensory here, it is discriminative touch. And the spinal trigeminal, the main function is pain and temperature. Each nucleus have a specific function. خلاص, we finish the ophthalmic division. Supply the eyeball sensation, النوز and the sinuses, ethmoidal air sinuses sensation, upper eyelid هنا and the lacrimal sensation. طيب, what about the maxillary nerve? Sensory, exit from the skull from foramen rotundum, very important, rotundum, which nerve passing through rotundum, maxillary. After passing through rotundum, it will go or ascend to the orbit again. This nerve enter the orbit through superior orbital fissure, but the maxillary will enter through inferior orbital fissure. يبقى after rotundum, go to the orbit again through inferior orbital fissure. After that, it will go in the floor of the orbit in the infraorbital groove. After that, it will go in infraorbital canal. And finally, it exits from the skull below the orbit through infraorbital foramen and will terminate as infraorbital nerve. This is a termination of the maxillary nerve. Supply what maxillary? The infraorbital nerve will supply the side of the nose, skin, the skin of the upper lip, and the skin of the lower eyelid. And during its passing through this fissure and the canal, it will give a very important nerve which supply the upper teeth, molar, incisors, canine, and so on, the upper jaw. So it is named superior alveolar nerve. Alveolar means to the jaw. Superior يعني to the upper jaw, supply the upper teeth totally. And also give branch to the zygomatic, skin of the zygomatic. So it is named zygomatic facial, to the skin of the zygomatic of the face, and zygomatic temporal, the skin of the anterior part of the temporal region. So this is regarding to maxillary. يبقى maxillary give infraorbital, supply the upper lip, side of the nose, lower eyelid, superior alveolar to supply the sensation of the upper teeth, and the zygomatic to the skin of the zygomatic and the skin of the temporal. What about regarding to the mandibular? Mandibular, we said that it is sensory and the small part is motor. So it is mixed nerve. The only branch which contain motor is mandibular. Exit from foramen ovale and divide into two division, anterior and posterior. Supply what mandibular? Number one, give the cheek. So it is give branch اسمه buccal. Buccal means to the skin of the cheek. Number two, supply the lower teeth and the gum and the chin. So it is named inferior alveolar. So inferior alveolar, which is supply the lower jaw, lower teeth. Number three, give the skin of the auricle and temporal. So it is named auriculo, يعني auricle and temporal. Number four, supply the tongue. Very important. This nerve supply the anterior two-thirds of the tongue general sensation through the nerve named very famous lingual nerve. Lingual nerve supply anterior two-thirds general of the tongue. So any lesion of the mandibular or lingual, loss of anterior two-thirds general sensation, and very common during extraction of the last molar, the lower part of the last molar. Number five, and finally, supply motor division. Motor to what? Number one, mastication muscle. Mastication like masseter, temporalis, medial pterygoid, lateral pterygoid. Please concentrate about the lateral pterygoid will open the mouth or depression the mandible, but the other muscle will elevate or close the mouth. Supply two muscles named tensor tympani and tensor palatii. Supply muscles named mylohyoid muscle and anterior pair of digaster. So, any patient came to your clinic, if you wanted to test the nerve, trigeminal nerve, ask the patient to close the mouth against the resistance so that to assess the function of the masseter, medial pterygoid, and the temporalis. And also ask the patient to open the mouth as much as he can against the resistance to assess the function of lateral pterygoid. And also he can bite in structure to assess the force of the bite. So the force of the bite means to assess the function of the mastication muscle. And finally, ask the patient to feel or by pen or by temperature or by touch any part of the sensation of the face regarding to the three divisions. Here we have trigeminal ganglia in the middle fossa. Trigeminal nuclei, we have three nuclei, mesencephalic in the midbrain proprioception, main sensory in the bones, and the spinal trigeminal in the medulla, and motor nucleus in the bones. Trigeminal nerve give three branches, ophthalmic, maxillary, and mandibular. The ophthalmic sensory from trigeminal ganglia and one of the content of the lateral wall of cavernous sinus, if you remember the atom, ophthalmic, maxillary, mandibular, oculomotor, and trochlear, and supply the eyeball, nasociliary, supply the lacrimal gland, and the front of the forehead. So these are the branches of the ophthalmic division. Regarding to maxillary, foramen rotundum, as we see here, from foramen rotundum بعد كده enter the orbit again, infraorbital fissure, infraorbital groove, infraorbital canal, infraorbital foramen, so will be infraorbital nerve, supply the side of the nose, skin, the upper lip, and the lower eyelid, and also supply the maxillary sinus and the upper teeth through posterior superior alveolar, and the zygomatic division, which supply the skin of the zygomatic and the temporal. This is regarding to maxillary. Mostly sensory. Mostly sensory. يبقى في lateral wall rotundum and infraorbital هنا nerve, and the upper teeth, gum, and the air sinus through superior alveolar, and the zygomatic face and the zygomatic temporal, and mandibular. Mandibular from foramen oval and by two roots, motor and sensory, and divide into anterior and posterior, and give lingual sensory to the anterior two-thirds of the tongue, the buccal to cheek and auriculotemporal, and inferior alveolar to the lower teeth and the gum and face. And the motor for mastication, masseter temporalis, medial trigoid, elevate or close the mouth or elevate the mandible. Lateral trigoid is the only muscle of mastication which open or depress the mandible. Anterior body of the gastric myel, any muscle named tensor, tympani, or palati supplied by mandibular. We have here the three division, ophthalmic, maxillary, and mandibular. And this is regarding to autonomic cephalagia, trigeminal, tearing, redness, dryness, nasal congestion from one side. We have also trigeminal neuralgia, the patient complaining of pain along the course of one of these nerves, and this pain persistence, so it is named trigeminal neuralgia. We can block these nerves during the extraction of the tooth in the upper or the lower teeth through inferior alveolar or superior alveolar block. This is how to assess the nerve motor function of the trigeminal by asking the patient to open, as we see here, to assess the lateral trigoid against the resistance. Thank you so much.